To close our program today, we went to Nucci Medical Center and Cyrus Nucci Foundation, leaders on the forefront of technology, to explore a high-tech alternative they are providing orthopedic patients for surgeries that require the use of replacement bones. The recent cadaver bone scandal, with its grisly funeral home theft of body parts that stretched from New York City to patients in Tampa, Florida, has given many orthopedic surgery patients cause for great concern, since most orthopedic surgeons use donated cadaver bone in surgery, or they employ the painful procedure of extracting donor bone from the patient's hip. Both procedures have inherent risks and great discomfort and extended healing involved in their use. Dr. Robert Nucci is unique among surgeons throughout the country in that he is the first surgeon in America to employ the use of BioPlex, a compound made of absorbable plastic and sea coral. Here to explain is Dr. Robert Nucci.
In spine surgery, there's a need to fuse the spine. Traditionally, one would use a patient's own bone taken from usually the pelvis. And this works just great. The problem is that when you remove bone from a person, you take it from their pelvis or another place in their body, it's very painful. And we have something called donor site pain and donor site morbidity. That means that the area we take the bone from is painful, it bleeds and causes problems. So we have looked for other ways to fuse the spine. One of the things we've used is cadaver bone. That's bone donated by a patient, taken and sterilized. And this works very well and is overall very safe. Unfortunately, in the recent past, there's been problems with donor bone that has not been harvested or taken appropriately. It's not been processed appropriately and has caused great problems. So we've been looking for other ways to fuse the spine that's even safer. I've been fortunate enough to use something called BioPlex, which is a combination of sea coral taken from the ocean and sterilized with a resorbable plastic. These two are married together into a composite which is very strong. When placed into the spine, what happens is the plastic will slowly dissolve and the coral will act as a matrix that a patient's own bone can grow into and become solid. It's very safe, it's very stable, and has a lot of advantages over a patient's own bone and cadaver bone. One being it is essentially an unlimited supply and the quality is always the same. So you know exactly what you're getting. I've been fortunate enough to use this now for the last 3 years and have had very good success with it with patients who are able to not have the donor pain and feel less worried about cadaver bone.
When chronic back or neck pain has lessened your quality of life, turn to America's first choice in innovative spine care and cures. Dr. Robert Nucci of Nucci Medical Center and Cyrus Nucci Foundation.